Hello, hello. Hi, everyone. Welcome. So today I'm going to be having Ava on, and we're going to be chatting about POI, HRT, and mental health. I'm so glad you guys can join us. So what we're going to be doing with Ava is, okay, so Ava is on. I'm going to get her on right now. So what we're going to do is we're going to talk about POI in order, and then we're going to talk about HRT and mental health and how POI affects mental health and how we manage our mental health. So let me get Ava on. Hi. So let's see. Okay. So if you guys have any questions at any stage, make sure to just pop your questions and Ava and I will answer any question at any stage. Hi, Ava. Can you hear me? I can't hear you. Can you hear me?
Yes, I can hear you. Sorry about that. I forgot
Okay,
my
that's fine.
headphones. How are you
Hey,
doing?
I'm good. Yourself?
I'm doing good, thank you.
Good, 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 good.
Th-
Good. It's great to like finally have you here. I know we've been chatting a lot offline, so I'm so glad that you're here with us today.
Thank
So
you. I'm so happy to be here. Thanks for inviting me on.
that's no problem. So Eva, we're just gonna jump right into it, okay?
Okay.
So what I want us to do is talk about POI first of all. So if you don't mind just sharing about your POI journey with everyone here today.
Yes, for sure. Okay. Hi, everybody. My name is Ava, Ava Vanderstarren, and I live in Canada. And yeah, I'm going to share some of my POI story. I was diagnosed when I was 17. Started having symptoms a little bit earlier. I stopped my
Network is very bad. Yeah,
and seeing if we could be sent to a specialist. Sorry if it's cutting out there a little bit. Can you see me?
I caught out a little bit there. We
All
lost you
right.
for a few seconds.
Sorry about that.
That's
Yeah, I
fine.
was just saying that when I was diagnosed, I lost my period when I was around 15. It started becoming irregular. It would go on and off, and then I started having long periods of time where I didn't get a period. And so we kept going to the doctor, pushing them to say, something's wrong. And my doctor would say, it's normal for a young woman to have irregular periods, and it will come back. Don't worry. And that happened a couple of times until we pushed to go and see a specialist. And when we did go to a specialist when I was 17, they diagnosed me off of a blood test on the first appointment that I went to. So that was very devastating. To be so young to get the diagnosis. And, at that point, I was still in high school. I was in my last year of school. And yeah, it was a really hard time. It was a really hard time in my life, I have to say. And, since then, over the years, I've gone through a lot of different things. But now I'm 28 years old. I'm on HRT now, which we're going to talk about in a little bit. And, that's kind of like my diagnosis and story.
Yeah,
If you have any questions, let me know, but I can, elaborate on anything. But
yeah,
yeah,
I think
that's,
for me, like you said, I think for me as well, I don't even remember the process of like I remember they did like blood tests and then I was diagnosed. Like let me just share a little bit of my story. I was
yeah.
diagnosed at the age of 19. Like I
Hmm.
had my first period at 15 and then I didn't have a period for almost 4 years. So and I remember being told as well that oh no, it's okay. You can it's okay to have period at a very
Yeah.
late age. It's some people get it at the age of 25. It's fine. So it's nearly like 4 years before I actually went and, seek medical advice. And I remember when I actually got in and went for a blood test, I didn't actually know what was going on. Like during during the time you were being diagnosed, were you being like kind of educated on what was going on, why the blood tests were being done and
I don't know for sure because I don't remember as well, but I know that it was something I'd never heard of before, and it was all very
Yeah,
confusing, and I don't feel like it was explained to me very well, because there's so much information to take in at the time, and there's so much to learn, and I do feel like, it was such a shock. I didn't quite understand what was happening, and also there was a lot of denial too, from myself and from my mom, of course, and people who are close to me in my life. And it was like, no, that can't be, you're so young. Every
yeah,
single person I seem to have talked to, whether they were a doctor or not, was like, you're too young to be going through menopause. That's not possible. It must be something else. So I was kind of in denial for a long time too, and not
yeah,
ready to accept it because then we also tried to go to like a different naturopath, and they said, no, like this can't be happening to you. Try this and this and this. So, for a long time, I think I was in denial about it and not really accepting the diagnosis for a little while. And yeah, I didn't understand everything. I don't feel like maybe everything was explained to me
yeah,
properly. Um, and I just tried to do some of my own research online, but also that's over 10 years ago now. And I felt
yeah,
like there wasn't a lot of resources for women. I definitely didn't have Instagram. And, Instagram is where I connected with you. And I think at that time I had maybe just got Facebook. Like there was not very much happening online to do with
yeah.
this kind of stuff. So yeah, so like I'm really happy I found your page on Instagram this year. And congratulations as well. I see that it's been about a year since you started your
Ah,
page. And it's
yeah.
amazing. I love your page so much. You share such
Thank
good
you.
information. And I
Thank
feel
you.
like now it's a little bit easier to look things up
Yeah, I
online and
agree.
to connect with people on, say, for example, Instagram
I agree.
and even Facebook groups and stuff. And now Zoom, like it's a little bit better easier to find information now. When I was diagnosed, I felt alone for a long
Yeah,
time. I never heard of it before, and I never heard of anyone else who had it. And I didn't meet anybody else who had it for a really
yeah,
long time. Like I didn't even know that there were other ladies who had it. So I felt all alone for a long time with it.
yeah. Me too as well. Like again, 10 years when I first got diagnosed, I was like, what? I didn't really understand what POI was then either.
Hmm.
Although it was called POF, I was like, what is
Same.
that? And I was in denial for a long time. I didn't know anybody else who had the same condition. So there was no one else for me to actually talk to about it. So I felt
Hmm.
really alone for a long time. And it's like you said, there wasn't a lot of social platform then that was talking about POI or anything. So now, like 10 years, a lot has really like changed. So
Hmm.
did you have any symptoms at all during the time? Like do you remember any symptoms that you might have had POI symptoms?
Yeah, but it's funny because when you're going through puberty, people brush off symptoms as like, oh, it's part of going through puberty and those kind of changes. I didn't know that those were symptoms of POI as well, or some of them overlapped. But I do remember having hot flashes, night sweats, and yeah, mood all over the place, highs and
Yeah.
lows. Um, of course, after getting diagnosed, there was like kind of the like depression and anxiety that goes along with it, and
Yes.
feeling low, and yeah, feeling alone for a long time. And I'm trying to think of some other ones. Of course, the missed
It's
periods.
hard
Yeah,
because you do forget, you do actually forget, like it's a long time. You forget a lot of the symptoms that you actually do
yeah.
experience. So it's hard sometimes to kind of remember them. Even
Hmm.
sometimes when I still come across like a page on Instagram that lists like all the symptoms, I'm like, oh wow, so I had that, I had that, I had that, I had that. And you start to
Yeah,
remember, like I remember having that, but you wouldn't have thought it was
yeah,
related to POI at all.
exactly.
So yeah,
Yeah,
some of the
exactly
symptoms
the
I
same
have,
thing. Exactly the same
yeah.
things. Yeah.
Exactly.
Hmm.
And some of the symptoms that I remember, I know there was more symptoms. It's like I actually went through my like old records and I found that like
Hmm.
my like headaches was my number one thing that I complained about to the doctor, and
Hmm.
pelvic pain as well. So I didn't even
Hmm.
remember that I had pelvic pain, but when I went through it, I remember, okay, that was one of the things I did complain about. And
Hmm.
I remember mood swing as well. That was like a major thing for me, mood swing and
Yeah.
just being all over the place, not understanding what was going on. with me. And I
Mm-hmm.
think over as the year progressed, there were more symptoms like vagina dryness and things like that came along with
Yeah.
it. So yeah.
Yeah, me
So
too. I
then
feel like that too. Like at the beginning, it was like a little bit, but then I was
yeah,
put on hormone medications like pretty quickly off the bat. So it started to get a little better, but then I would still have things. But
yeah,
yeah, definitely as it progressed to the point of like instead of like just the early days of it, like into full blown menopause or POI, POF, as they said, yeah, like I had all of those symptoms too. And like you, I can look at a list of symptoms and see all of the same, and be like, yeah, I had that, I had that. And like, yeah, like having a regular period and then no period for a really long time was one of the main
yes,
ones. Like that was the one that was the most concerning of like, why do we need to go to the doctor? Like what's going on? And everything else was kind of brushed off as like, oh, you're a teenager. All teenagers have like mood swings or, irritability or fatigue, like, and like now, yeah, I have fatigue or joint pain, muscle pain, or like problems sleeping, or go through different periods of stuff like that. And then, yeah, like there's the problems that you mentioned too, like sexual problems, libido,
yeah,
low libido.
exactly.
Yeah, yeah.
I actually made a list. I'm sure you made your own list as well.
Yeah,
I actually made
yeah.
some lists because it's easy to forget things, especially with that brain fog. It's easy to
Hmm.
forget. So it's better to actually make a list and go through them. So for me,
Yeah,
it was like no period for nearly 4 years, like hot flashes, night sweats, anxiety. Like I used to have bad anxiety, mood swing, brain fog. Even people that know me remember from a very young age, I was very forgetful. And they used to wonder, Anita, why are you so forgetful? What's wrong with you? Like I
yeah.
had no idea that it was actually associated. And one thing I
Hmm.
actually found out recently, the list that you shared in regards to POI symptoms, I saw something about feeling dizzy and fainting. So,
Yes.
and that brought me back to when I was younger. I used to faint a lot when I was younger, and I would end up in the hospital with drip. I didn't like actually seeing that. I was like, maybe that could have been an earlier sign.
Yeah,
And
maybe.
so that was quite surprised when I saw that on the list because that's not something I actually knew was part of fainting. I know dizziness was part of it, but fainting, I didn't think that was actually part of the list as well too. So
Yeah.
I was surprised to see that. And vagina dryness, difficulty sleeping, pelvic pain, like I said already, and just lack of concentration. It's like I still
Hmm.
suffer majorly with poor lack of concentration. So
Hmm.
those are some of the symptoms. Like we it sounds like we both
Yeah.
have like similar symptoms as well too.
Yeah.
So it's
Yeah.
yeah,
Same. Sorry, I didn't mean to cut you off, but yeah, the
it's okay.
same,
Don't worry.
like I have the same ones too,
Yeah,
and like, yeah, like some of them come or go, or some of them you almost get used to them, which is kind of weird, but like it just becomes your normal for
yeah,
you. But yeah, sometimes they're more intense than others. But yeah, I have also fainted a few times, or I do get dizzy sometimes,
yeah.
and like you just, when that happens, you're like, oh my goodness, what's wrong with me? What's going on? But yeah, also heart palpitations. I did have some heart
Yes.
palpitations too. I remember going to get my heart checked, wearing a Holter monitor to monitor my
Wow.
heart, and going for a stress test on they hook you to the machine, and then you do some running on the card on the treadmill. And yeah, I remember like all of doing all of that stuff too. Like I have that too. So yeah,
It's crazy. It's not easy. Okay,
I
so
know.
what we're gonna move on tonight is talk about like the HRT, the first time you got on HRT and
Sure.
what HRT you're taking, and we'll move on
Yeah.
from there. Let's see if there's
Yeah,
any
yeah, I just
questions.
wanted to say hi to a few people. I saw Lori. Hi, Lori. How are you? And a Sierra Leone one-to-one joined. Hi, guys. We're talking about premature ovarian insufficiency. Sharing our stories is something that both Anita and I were diagnosed with over 10 years ago. And in Anita's amazing page, The Blossom Living with POI.
Thank you.
Oh, I see Life of POI is watching. Hi.
Yes. Oh, is that okay? Let's see.
And someone named Lucy, and I see a few other people. So, hi
Yeah,
everyone.
thank you guys so much for watching. Really appreciate it. Okay, so HRT, let's get down to hormone replacement therapy.
Yeah. So, it's also another confusing thing when you're first diagnosed, especially because you're like, do I start taking hormones? Like, I don't understand what's going on. For me, I was on a bunch of different ones over the years. I got started
Yeah.
off right away when I first got diagnosed, I got started off with prometrium, which is a progestin pill, and
Yeah.
estrogel that I rubbed on. And then over the years, I switched a lot. I've switched a lot of different times, and I got put on birth control pill for a long time too. So yeah, and then
I
now I'm
think we
back.
actually talked
We're
about
going to talk
that. Sorry,
about
yeah, we
that.
talked about
Yeah.
that. Yeah. Eva told me that she was on birth control for a while. I was like, birth control, like, were you on H? That's one of the things I've noticed. Like, why would you give birth control and you don't give like HRT treatment right away and you just remain
Hmm.
on birth control because birth control is not an HRT treatment,
Hmm.
and I've also heard in some cases they say if you're on HRT is not, it does not prevent pregnancy just in case. You
Right.
have to be sure you take birth control. It should also be the same way the other round where you're on birth control, make sure you're also on HRT treatment. So yeah.
Yeah, I know. And for anybody who doesn't know, HRT stands for hormone replacement therapy.
Yeah.
And yeah, because our hormones are lacking, we don't have our body's not producing them ourselves.
Enough
And yeah, and
estrogen. Yeah.
estrogen, progesterone, and so yeah, like I think a lot of doctors just didn't know. Like if they're not specialized in that area, they just won't don't know. And I
Yeah.
think my doctor was like, "Well, you want birth control option because you're." I was young, and I was like, "Well, I have this going on. I'm not ready to start a family. Like, what if I did end up getting pregnant or something? Like so." I wasn't ready to have a baby in my early 20s. So I ended up saying, I also need birth control options. And so then my doctors would just be like, well, why don't you just go on the pill, like go on birth control pill? That's going to be birth control and your hormones. And I was like, okay, and that got recommended to me by a couple doctors. And so that's what I did for many years, and I went on a couple different brands. I think over the last, like there was maybe a 5-6 year span when I was on it, and I probably was like on maybe 3 or 4 different brands. And then I stopped taking it when I was on Yaz for the last little bit, and I ended up having a blood clot scare. So some people, Yaz causes blood clots, and it did for me. I remember I had like an anxiety attack at work, and I was feeling really sick, and
Oh,
something was wrong with my body. And
yeah.
that day was really scary because like I had felt some weird things happening in my body. Something wasn't right, and my legs had some bruising on them, and I was like, what's going on? And and then at work, I went to work, I was feeling sick, I was feeling gross, and I had like an anxiety attack at work. So I ended up going to the hospital. I went to the emergency. They said, you know what, I think it's best if they took me with a car to the hospital. And I got checked. And luckily, like I stopped taking it that day and I didn't take it anymore. But it was caught early. I didn't end up having a formed blood clot, but my blood was starting to clot more. And I remember when I had withdrawing bleeds on that too, it was really
Yeah.
bad. It was really clotty too. So that one was not good for me. And so I stopped because then I got scared. I was like, I don't want to get blood clots from this.
Yeah.
And then that was really awful for me too because I didn't have another prescription. So I remember when I went off of it, then I got full blown, all the menopause symptoms came back.
Well,
All the
yeah.
symptoms on the list came back like with full force, like really intense. And it took me a while before I got an appointment in to see my doctor who specializes in women's health and POI stuff. I think she sees a lot of patients who have POI, and finally got onto the hormone replacement therapy again,
So
which I've been on since then. So that was really scary, and it was
that
just,
is scary. And like during the time you were on the birth control, like were you not getting the um POI symptoms during that time on the birth control?
um, just like a little bit,
A little
just
bit.
like,
Okay.
how it is kind of now, I think. Like it
Yeah.
helped to manage the symptoms a bit, like, but it wasn't, it wasn't perfect. You have like any kind of hormones that you're taking, I think it messes around with your system a little bit, right? So I was still getting some symptoms, but I was just like, this is all I knew. Like I was my normal. Like I didn't know that there was, anything else going on. And I
Anything
felt,
else? Yeah.
yeah, and I was following the advice of my doctors to get that birth control pill. And so that was, yeah, it was really scary. And then since then, what I'm on right now is I got an IUD, the Mirena intrauterine device That is what I have right now, which is supposed to give me some progesterone. Um,
Yeah.
and then and then I take estrogel, which is an estradiol rub-on gel, which is supposed to be bioidentical HRT. That's what I'm on
Okay.
now. Yeah.
Perfect. And how's that going for you?
I think it's good. Like I liked it. I think it was really good for me for a while. Of course, when I first got the IUD, I had a lot of bleeding and a lot of spotting. So it took my body a while to get used to it. There was a couple of months where I was bleeding and spotting like almost every day, or then it would go away for like a week or two, and then I would have bleeding and spotting again. But once my body got used to the IUD, it took about maybe 4 months and then it completely went away. So now, since then, the last year to 2 years, I haven't had any spotting, no period, nothing, like nothing like that. And then the estrogel, like, yes, I do have to rub it on my skin every day. So it is, it can be annoying to be like, oh my gosh, it's that time. I need to find a bathroom. I need to go get my medication and put it on. But it's
Yeah.
really important. And I think that does help me a lot. If I didn't have it, all my symptoms would be way worse. It's not
Yeah.
nothing, it's not perfect, but it's something that's helping me a lot. And I think
Yeah. It
it's really
helps.
important.
Yeah.
Yeah, it's really important for bone health and heart health and to have the estrogen in your body. And yeah. And how about you, Anita? And I also see a comment
I
here.
think there's a question. Yeah, I'm on. What's that? Okay, that's good.
Yeah, I
Nitrogen
haven't
and
heard
gel. Yeah.
estrogel. Yeah. Yeah.
I think what I've noticed that a lot of people seems there are a lot of people are on the estrogel, so that's kind of something I'm trying to explore because I'm trying to explore more at the moment. I'm trying to explore like more alternative HRT treatments because for a
Mm-hmm.
long time I was initially on the Avon patch. So I started with the Avon patch right away as soon as I was diagnosed. And
Mm-hmm.
I was on that for like, if I think it was 2 or 3 years, but the side effect from that was just too much for me. Like my breast was so tender, like I
Okay.
couldn't lie in my bed, I couldn't do anything much with it. So I went back in and they prescribed the Femistone counting one by
Okay.
five, which was a lower dose. So I was on the Femisto County 1 by 5 for 8 years. And then
Okay.
I noticed that some of my menopausal symptoms were coming back. So at that time, I really had no one to talk to about it or to even like express my concern on what needs to be done. So I was really alone for a long time because so what I did then is I did my own research online to see, okay, what is the higher dose of Femisto?
Right.
Femisto 2 by 10. Then I came across the Femisto 2 by 10. It wasn't counting. So it was
Mm-hmm.
broken down into progesterone for, I think it was 12 days or 14 days, and estrogen for 12 or 14 days. I was on
Okay.
that for 9 months. And that was
Yeah.
the first time actually in years that I had like a monthly withdrawal bleeding because it was broken into two. It's meant to
Mm-hmm.
induce withdrawal bleeding.
Mm-hmm.
So initially, when I started getting my period during like on a monthly basis, I was like, "Oh wow, I'm getting period. That
Yeah.
means things are getting better." But I didn't realize, oh no, it's just
I
it's
know.
just the HRT doing its thing. So I
Yeah.
had to stop the Femestotune by 10 because I know some things were just some side effects. I wasn't sure if it was related to
Yeah.
the HRT, but again, there was no one to actually talk to. I was doing a lot of research myself, finding out a lot of information myself. So
Yeah.
I made the conscious decision to go back on the Femistone counting 1 by 5. So that I've been on that now for the past few months. So it's been a roller coaster. So I'm trying to
Yeah.
now hopefully see somebody soon. So I'm trying to explore other HRT treatment in terms of that. I've
Yeah.
heard good things about the institute gel. So I'm trying to
Yeah.
explore and see if the gel could be something I could
Yeah.
try. I'm trying to just,
Mm-hmm.
yeah.
And I
So
think everybody's different, right?
yeah,
And I think it's really important to keep exploring until you find one that works for you because, if it's not working well, you got to keep trying until you get one that works. And I remember having to
exactly.
try so many different things, but when you find the one that works, it does help with the quality of life a lot, right? And I think that the estrogel for me gives me, like when I was taking it, we tested my estrogen when I first went back on it again to see what my level was at. And I think
Yeah,
it was a little bit higher, like I had a lot more estrogen, so it helped me feel a lot better. You know, like it was in like 200 to 300 range. I don't know if you have the same kind of testing, but
Yes, me too.
yeah, yeah. So you know, I think that was helping me a lot with some of my symptoms. But lately, I've been starting to feel like more of my symptoms have been coming up, and I don't know if it's just from POI stuff or if it's because of stress or extra fatigue or what's happening. So I'm trying to get down to the bottom of it. And basically, like the last 6 months, there's been something I've been feeling is not quite right. And I'm trying to get into my doctor. I'm on a waiting list right now. So hopefully, I'll get in to see her pretty soon and just make sure everything's going okay.
Yeah, the same thing here. Like last summer, what I did is I went to my GP and I requested some blood tests, like for everything that was going on. So we did some blood tests on HRT, and
Mm-hmm.
when the result came back, my estrogen was like around 200. So,
Mm-hmm.
which I heard that it's really good because around like 200, that's actually very good. So, since I went back on the Femiston County 1 by 5, I don't really know what the level is right now. So, the next thing is to
Mm-hmm.
go in and hopefully get some blood work and see, like just like
Okay.
yourself, I have been feeling slightly off for the past few
Yeah.
months in terms of
Okay.
feeling very fatigued, back pain and migraine and things like that. So, but
Yeah.
again, this is the other thing as well. It's so hard because I also do suffer from thyroid and they have like similar symptoms.
Right.
So it's so hard sometimes to kind of identify them. But it's like I always say, it's worth a try doing a blood test for both of them just to, see
Yeah.
what's
I
going on.
hope I hope
Yeah.
everything is okay with your thyroid because it's just hard when you have so many different things going on, you know? It's hard.
It's not easy. But anyway,
Yeah.
I think with a thyroid, for anyone, if you have a thyroid on top of POI, it just make things just extra kind of difficult because it's just if you're tired, you're extra tired. When you have a headache, you have like it's as if your head is just pounding.
Hmm.
It's crazy. But anyway, gonna
We
keep
have a
going.
question. We have a question
And,
here.
do
Someone said hello, Ramata Kane. Hi. And Rachel said, does your doctor make you stop all HRT for 6 months every time you change HRT? For me, it's no. For me, I don't, because if I was to stop, I would, like, all my symptoms would come back, and not having estrogen for that long, I don't think is good for your bones. Correct me if I'm wrong,
The
Anita.
same for me. I didn't have to stop. I had to go right on the next HRT because if I stop it for that long, again, all my symptoms would just come back. You need to, because I'm on the continuous HRT, so I have
Hmm.
to always be on my HRT
Yeah.
treatment. So it's no, not for me personally, no. But
Me too.
why would they advise you to do that? Would they give you a specific reason to why though?
Yeah, Rachel, if you're still on
Rachel,
and you're
yeah,
hearing, feel free to type back because, yeah, also like the things that we're talking about with HRT, why it's important is like the bone health. I've heard of women sharing their stories where they didn't go on HRT and now they're dealing with osteopenia or osteoporosis and stuff like that. So, also, of course, supplementing with calcium and vitamin
yeah,
D, and that is so important. But in order for that to be helpful to your bones, you have to have estrogen in your system, right? And if you
yeah.
don't,
Yeah, and I think like maybe it's more education is needed on why you need to take HRT. I feel like when you're being told that you need to take HRT, it's more like they tell you HRT help relieves menopausal symptoms, but they
mm-hmm,
don't actually tell you that the estrogen is so important. Like that estrogen is what you need. It's so important because, like you said, it
mm-hmm,
looks after your bones, your brain, your heart, your muscles, and everything. Like even with the
yeah,
vagina
everything,
dryness, yeah, it looks
mm-hmm,
at everything. I think that needs to be what is highlighted that you're
yeah,
lacking estrogen. So you need estrogen to help with everything in your body, your productive system. So that's
uh-huh,
why it's important to be on HRT treatment. Because a
yeah,
lot of the time, like you said, people don't go on it because they're like, oh, I don't need to be on it. And whatever works for you. But at the end of the day, when they come back and go on
mm-hmm,
HRT because of their health issues, because of their bones
mm-hmm,
and everything, I think that needs to be put across and highlighted that it's important
yeah,
and to,
and
yeah.
yeah, and I think it's important to go for a bone density scan if you can,
Yeah,
at least once after you've been diagnosed to see where your level's at, and then you can check your bone density again. Because nobody wants to be in their 20s or 30s and dealing with osteoporosis. And that has happened to some ladies. And the thing is, I remember also hearing recently too that people saying that the hormones were not good for women, but those were studies that were maybe done with women who were in their 50s and 60s, you know. But for us at our age, we need that. It's for
Yes.
overall health. It's not that we're adding hormones on. It's because like when you get older and you go through menopause naturally, your hormones naturally go away, and
Yeah.
then you go through menopause in that cycle. But when you have it at a young age, you still need that through your whole life for your quality of life, because otherwise your life expectancy can go down. Like your
Very slow.
quality of life is diminished a lot. So it's really important to have the hormone replacement therapy there, because it is replacing the hormones that we should have at our age,
Yes.
right?
And I
So
think, yeah, just to add to that as well, I think also when it comes to progesterone as well, it's with women that have uterus that I hear that it's very important to actually, make sure you're on progesterone because it protects the lining of your womb. And I noticed
mhm,
that a lot of women are not on it. They say, "Oh no, I'm not on progesterone." I'm like, "Could you
mhm.
still have a uterus?" Like, yeah, but that's just to me I can be on estrogen. That's fine. It's also
Mhm.
important to be on progesterone because estrogen and progesterone are equally important for your overall health.
Yeah.
Rachel said, my doctor never told me why. I changed HRT 3 times and he made me stop everything. Okay, that's
Okay.
you should definitely. If I was you, I would like. Is there a reason? Like, if someone asks, like, if my doctor wants me to do this or do that, what I do now is I actually ask, what is the
Mhm.
reason for that? So I would definitely go back and ask, what is the reason for stopping the HRT? Is there a
Mhm.
reason for it? So just to get your answer to that,
Mhm.
because
Mhm.
that's a bit strange to be asking you to stop it.
Yeah, I know.
Yeah,
I don't want to give any medical advice either. Like, definitely ask your doctor,
yeah,
but I think it's
absolutely.
very important because also, like, for me personally, if I was to stop it for that long of time, my hormone roller coaster ride would be so intense, and I
Yeah,
think it would actually be worse for me in the long run.
yeah, and it's like
Yeah, and every
starting
time I
over
stop, the
again.
menopause symptoms get
Yeah,
worse, is what she wrote down. And
yeah.
hi Danielle, thanks for
Oh, hi,
joining. My
Daniel.
friend
And
Danielle's
then,
on.
oh, hi. Thank you so much for joining us. Every time I stop, the menopause symptoms get exactly. And I think it's like starting over again. Like if you stop it for 3 months and then you start HRT again, you're gonna go through all like the side effect again, withdraw bleeding for a certain amount of time. So it's like starting all over again. So I would definitely, my best advice, like Eva said, is to ask the reason why and see
Hmm.
what the doctor has to say. Yeah.
Hmm. And maybe
Eva,
get another opinion too. Like if you have
yeah,
another doctor you can ask as well that is dealing, that knows things about females' hormones and this type of thing, just to getting
yeah,
another opinion if possible, right?
yeah,
If you're
definitely.
not feeling right about it. Yeah.
Perfect. Eva, what were some of your side effects from your HRT? Like, what's kind
Like you mean like I think I have positive side effects from it, but I'm not sure.
of, let's
Like
hear
I think
that.
I think my positive side effects from it is reducing a lot of the menopausal symptoms,
Yeah,
like the things that are really, really disruptive.
of course.
And then, yeah, what we were just talking about, bone health, heart health, overall health, mental health, I think it helps with everything.
Yeah,
So I think for me, it's really important to be on something, because
yes.
if I don't, like, I'm pretty far into this condition. So if I go off of HRT, it's full menopause. It's not like perimenopause or anything like that. Like I've had this since I was 17, over 10 years now. So for me, if I go off of hormone replacement therapy, it's really, really bad for my body. It's going through like a lot, right? So I don't know about negative side effects, except for what I was explaining when I first got the IUD, of all of the with like all of the spotting and the bleeding that I was having, which seemed to have now gone away. So I don't know if that was just my body getting used to it. So I think that was my major one. It was with the IUD for the progesterone, was just my body getting used to the IUD and the spotting and bleeding for such a long time. And then I don't know if I have any negative side effects from my estrogen or from my IUD, because um, if it's a side effect, it's either, is it from that medication or is it my POI symptoms that I have, like
I
with the
know.
mood swings, with or depression or
Yes.
anxiety or joint pain or headaches or fatigue or memory problems, like all those
Yeah.
things we were just talking about. Like I don't know, is that just my POI and it's my or is that a side effect of the
Yeah, I
medication?
think
I
like
don't
we spoke about that earlier. I actually told you, I was like, if you actually think deep about it, like some of this like side effects of POI, once you're on HRT, like it's supposed to like relieve the symptoms and it's estrogens provided for you. You notice that you are actually still getting some of the symptoms, but then are they side effects or they're still like POI symptoms? Like for example, you still get like mood swings, and mood swing
know.
is part of symptoms of POI. One of the things I said, mood swing, vagina dryness is still there. So
Hmm.
sometimes you think, then do I need a higher dose of
Yeah.
HRT then to help with the vagina dryness, even though your estrogen level is around like 200, it's pretty much good. You're still
Yeah.
suffering with like vagina dryness, so you start to
Still,
wonder as
so
well. And there's
yeah.
still a lot of things. Yeah, go
Yeah,
ahead.
go ahead. No,
Go ahead.
I was just going to say that too,
Yeah,
like, and I don't know if that's just something we have to deal with forever or if
it
there's,
is.
things, but just finding the right kinds of lubricants and making sure
Yeah.
that you're taking care of yourself properly is really important. And I
Mhm.
know it's a topic that's hard to talk about because some people get very embarrassed and stuff, but like, there is also estrogen that you can put inside of your vagina. I don't know
I think it's
if
called
you've ever
what's it called? I can't remember
Vagifem
now.
or
Yeah, that is Vagifem. I think it's
there's a
Vagifem.
few different brands, but
Yeah,
yeah,
yeah.
yeah, yeah.
So for me, some of the side effects, I had like positive and negative as well, just like you. Of course, the positive is helping with your bones, just like you said. For me, I don't know if you ever got like tender breast. For me, tender breast was like really, really bad. Like my breast is always tender. And recently, when I went to the hospital because I had some physical exam a few months ago, and they told me that like there was like the lump on my breast was not consistent with the rest of them. I got really scared at that point. I was like, what is going on? So I went into the main
Yeah,
hospital
that's
and they did
scary.
yeah, I was scared. So they told me that there was a name for it. I can't remember. I put it here actually. And they told me that I have that not to worry about it. It's just breast. What was it again? Did I write it down? I think I thought I wrote it down, but I can't remember, guys. Sorry. I'll leave it in the comment that not to worry,
Oh,
that it's
like
just
the tissue, breast tissue.
yes, a breast tissue, but there is a name for it. It's a breast. He said that it was the breast tissue, and it's just that there's more on the right hand side than the left hand side. That's why
Mm-hmm.
it's a bit more tender, and it's like inflammation from. So that's when I told him, I'm on HRT. He was like, "Oh, you're on HRT." He's like, "Yeah,
Mm-hmm.
that's the reason why because
Okay.
you're helping me with it." So I was like, "Okay." So
Yeah.
at that
And
stage, I was like, "That's good to go ahead."
did you have a mammogram?
I did. No, I didn't have a mammogram. I had an ultrasound. So, but the doctor recommended for me to have my first mammogram at 40.
Okay.
So at 40, I'll be having the first mammogram. But for now,
Mm-hmm.
everything is fine. So I was very happy to hear that.
That's good. Yeah.
Yeah. I had so in terms of then, I think that covers like. Is there anything else you want to add to HRT?
Yeah. Did you have any other negative symptoms or positive symptoms you want to say?
In terms of negative, I think just bloating. I had a lot of bloating. I noticed that my stomach region was getting bigger, like
Okay.
was actually getting bigger. Initially, I didn't know why, but I know that bloating is a side effect. And also back pain. I still do get back pain, but again, that's the other thing we were saying.
Me too.
Is
Yeah.
that POI or is that side effect from HRT? It's hard to
Right.
tell because when you actually do look at the leaflet or you search online HRT side effect, back pain is part of it, but that's also a symptoms of POI. So it's sometimes just
It's so hard to tell.
it's
Yeah.
yeah, it is. And mood swing is something I still deal with a lot.
Mm-hmm.
Leg
Mm-hmm.
cramp. I do get leg cramps
Mm-hmm.
for me. Irritation. Sometimes I just get really irritated.
Yeah.
It's true. Sometimes I find myself getting very irritated. I'm like, what's going on? And I realize, okay, yeah, it's okay. I need to take it easy on yourself.
I
I
know, I know. There's so many things that can go along with it. And I'm just looking through
know.
my list of symptoms too. And yeah, I think memory problems as well. Like, I think, sometimes people have commented, oh my goodness, like you can't remember that. But there'll be things,
Yeah.
some things like events, like sometimes I can remember some details, but sometimes there's things where I completely forget that they even
Mm,
happened.
yeah.
Like there's some gaps there sometimes, which can be really scary.
It's and
Uh,
one other major thing I realized is when I initially went on the Femistone County 1 by 5, I noticed I had a lot of like itchiness and soreness around my vulval area. I've
Okay.
learned that it's not I used to call it vagina, but I've learned that it's vulval, not vagina.
Yeah. Yeah.
So I had a lot of like itchiness and soreness around there where I noticed that my skin was actually like peeling. So that
Oh,
was
sorry
actually
to hear
one thing
that.
I went to, yeah, that was one thing I went to the doctor and he said, yeah, that could be also be side effects from HRT, especially if you're starting for the first time.
Yeah.
So but it's much, much better now. But that was something I noticed that I did experience. I just wanted to share that because a lot of people do experience that as well too. And
Mm-hmm.
I think
Mm-hmm.
what else? Constipation. I don't know if that's something you ever experienced.
Okay.
Uh,
I don't
yeah.
know because like I had digestive problems on the list as a symptom of POI, but then I sometimes
Mm,
I don't know, is it my diet and what I'm eating, or is it have to do with
yeah.
POI, or does it have to do with medication side effects? I don't know.
Constipation.
Yeah.
That's the thing. I-
Mm-hmm.
It's it's hard to tell sometimes because sometimes you feel like you're eating right, but you still
Mm-hmm.
have constipation and you wonder why it's
Mm-hmm.
that happening. But I've noticed that sometimes it could be with the HRT as well too.
Mm-hmm.
And I think that's pretty much. I don't have anything else. That's a couple of things that I have down
Okay.
here.
Yeah.
Yeah,
And that's the thing too. It's so hard to, like we've been saying, about knowing whether it's a POI symptom or a side effect of the medication. But I still personally feel for myself that the HRT benefit outweighs any side effect that I'm receiving at the moment. Like that can change because your body's always changing, but like even though it can be difficult to be taking hormones, I think it is really, really important for your overall health. And
it
that's
is.
what I've been feeling for myself. So I know like it can be overwhelming to think about going on different hormone medications and stuff. But if you find the right one that works for you, it can make a world of difference with your quality of life.
I agree 100%. I feel like even now when I ask myself, I can't imagine not being on HRT because I've been on
Mm-hmm.
it for such a long time. So
Mm-hmm.
I will definitely that's something I will definitely not be like giving up anytime soon because I know
Yeah.
how beneficial it is to my health. So yeah,
Yeah.
definitely.
Yeah.
Um, so when we talk about, let's talk about mental health then.
Okay. Sounds good.
So when we talk about mental health, we know that POI can affect our mental health, not just like in terms of infertility, emotional, physical, and it can affect us impactly and have a major impact on our mental health. So how has POI affected your mental health over the years?
Yeah, I when I was looking at the list of symptoms again, and I saw that anxiety and depression was on there as like a symptom or a side effect of POI, and
Yeah,
I was just like, oh my goodness, like sometimes you're going through lots of things in your life, and you don't exactly know why you might have anxiety or why you might be going through different stages of depression, but then just like knowing that that can be really linked to your hormones kind of made me feel a little bit better and be less hard on myself, because I feel like I
yeah,
can be very hard on myself as a person. But
yeah.
yeah, like, so I have had, anxiety, and I still sometimes am dealing with that certain days. Uh, and sometimes depression. I think my depression has gotten a lot better. It's more like low mood. Right now, I don't have depression, but when I was first diagnosed, there was definitely like a period of depression I went through where I was coming to
Yeah.
terms with the diagnosis. And like you said, the infertility part of it is such a big, devastating blow. Like if you wanted to have kids, and being told that, it can be so devastating. So that was something I had to deal a lot with over the years. So yeah, I would say low mood. And then at some points over the course of the last 10 years, I've had depression, and then I go with anxiety on and off. But like, yeah, that's kind of, I think, my main points there. How about you?
The same for me actually. For me, like I said earlier, mood swing. It's still
Mm-hmm.
something like I still sometimes. So I've kind of found a way to when I recognize that I'm going to like I'm really moody. I recognize, okay, this is happening as long as I'm very aware of it. And I try to, especially when I'm surrounded by family or friends, I'm in
Mm-hmm.
a very bad mood. I try not to kind of put my mood on them. So I'm very kind of aware of it. So I think
Mm-hmm.
and for me as well, anxiety, yes, anxiety, it's one thing. Like, yeah, even before we started this video, I could hear my heart already pumping, pumping. I was like, relax, relax,
Mm-hmm.
relax. So anxiety is something I deal with all the time. Like I think I said something the other day. Like my granny always used to say, when you have anxiety, it shows that you're passionate about whatever it is that you're about to, whatever it is you're about to do. So I take it
Yeah.
that way.
Yeah.
And yeah, for me also, let's see what else. I have a few things here. I still do get like heart palpitation once in a while. That's one thing I've noticed as well too. I get heart palpitation,
Mm-hmm.
but it's not as often as it used to be,
Mm-hmm.
but I still do get it once in a while. And
Yeah, same.
yeah, that's pretty much it. Just a few of those things. And I think it kind of depends on the day as well too. Some days are better than others
Mm-hmm.
as well.
Mm-hmm.
So these are some of the things that I still do. How POI affected my mental health. And I think the major thing actually is the lack of concentration for me.
Mm-hmm.
It's so hard sometimes to actually just focus on one thing. I find myself just kind of being all over the place all the time. So I try to
Mm-hmm.
draw myself in, but that has improved dramatically compared to before. But I think that as
Mm-hmm.
well, and just the brain fog as well too. It's
Yeah.
sometimes you're having a conversation, you're doing something, all of a sudden you're blank. You're like, what
Yeah.
did I do? You're looking for something. Where did I put that? And people don't tend to understand. But yeah,
Mm-hmm.
those things as well,
Yeah.
it plays a major part for POI
Yeah.
definitely affects me that way. I think POI has actually stopped me in terms of some things that I wanted to kind of, let's say, accomplish in life. I had to take a step back because, it affected my mental health so dramatically that I had to make like changes in my
Mm-hmm.
life just to kind of make things easier for me and be able to kind of just live a life whereby, it's not hectic, basically.
Yeah,
So yeah,
totally. Yeah, I understand that too. And I feel the same way as you as well. And also fatigue, I think I've been dealing with a little bit more lately. And I've been kind of angry about that, like I feel like it holds me back a little bit. Like there's things I want to do, but then sometimes the fatigue is too intense that I have to just
um,
take the resting time. So like you said, like restructuring some things in life to make it a little bit more balanced is what I've been working on. And yeah, I have definitely changed my hectic lifestyle because, especially when I was first diagnosed, I think I was doing too much. And I still think I tried to do too much over the years, but trying to get more balance. And I've slowed down a lot in the last couple of years,
that's good.
just because I got to the point where my mental health was suffering too much and I will
Yeah,
get burnt out. I would go, 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 go until burnout, and then I will be absolutely exhausted. And then it wasn't balanced enough, and I've been really trying to work on keeping that balance more.
that's good. Yeah,
Um, yeah, but yeah, so like you said, some days are different than other days, and some days I'll have anxiety, but I don't know why. Like there's no reason, like I do get like performance anxiety before a speech or an interview or something, or doing things at work,
yeah,
but sometimes there's no real reason. Like sometimes I just feel overwhelmed or I feel anxious about stuff, or I'm going over things over and over and over again in my minds and
yes.
obsessing about stuff. And yeah, it's been something I have to work on to help to get out of those
Yeah,
cycles when I get in those. But yeah, like
yeah,
I wanted to talk about some things that we've done for helping our mental health. Like meditation has been helping me a lot, and also
that's good.
counseling, I think too. So yeah, I have a really great counselor, and if anybody is watching needs a counselor and wants me to send them information, I can share the info with them, send me a message. But yeah, I think that counseling is really important to work through everything, especially there's so many things going on in life already, and then you have to deal with your diagnosis and come to terms with all the stuff that goes along with it. I think it's really important to take that time and to work through it with a counselor, because otherwise it can just constantly feel overwhelming, and you push it away and push it away and not deal with it, but then it comes out, and it comes out in times when you don't want it to. But
You
like say
suspected. Yeah.
say there's like a period of more stress in your life in other areas, then it's just like everything just comes crashing down. Because if you push it off too far and you don't deal with it and you don't work through it, it always comes back. It always comes knocking on your door like, hey, I'm still here. You got to deal with me. Like,
You can't get
yeah.
rid of me. I'm right here.
Yeah,
Yeah.
exactly.
Yeah.
Yeah.
I think just before I share some of the things that I do to help my mental health, I think one of the big things as well in terms of how much impact mental health had on me was that it got to a stage whereby I started to feel so guilty that, I was allowing my mental health or my POI condition to kind of stop me from doing things that I wanted to do. I felt like I was making excuses. But
Mm,
I really had to come to it got to a point where I broke down completely, and that's how important I said, okay, no, this is actually, my mental health is actually very important. I need to take it very, very seriously because,
yeah.
if your mental state is not stable or it's not in the right place, you're not going to be able to do what you want to do. And sometimes it's okay to take step back and not be able to do the thing you wanted to do because the
Mm-hmm.
it affects your mental health. So it's just, you kind of have to find out what works for you or what doesn't work for you then, basically.
Yeah. Yeah.
And some of the
Maybe
things,
restructuring things sometimes.
exactly, restructure
Doesn't
things
have
and
to,
things
it's not
actually work.
always the way you think it will be, but you could still maybe get your goal, but just like making a little bit more time or being less hard on
Exactly.
yourself or, yeah.
Yeah. Finding
Yeah.
another way to get to it, a way that makes it
Mm-hmm.
more easier for yourself to get to it and trying to go one way. So that's one thing
Mm-hmm.
I've learned. So some of the
Mm-hmm.
things that work for me in terms of maintaining my mental health is keeping active. So
Mm-hmm.
like an active lifestyle has been like it's really helped me a lot when I don't work out or anything. I like my body actually feels it. Like I feel like I need to do something. So that's
Mm-hmm.
really helped me. Acceptance, actually, when I talk about acceptance, I think for a long time, I didn't talk about it. I wasn't open about it, and I wasn't willing to acknowledge it or anything. So acceptance, actually accepting that, okay, I'm going through this, this is happening,
Mm-hmm.
and then talking about it has actually helped me dramatically.
That's great.
And and music, listening to
Yes.
music. Music is a great therapy for me. I always continue to say that I love listening to music. It helps me in even when I'm in a bad mood, just put music on. It lifts my spirit
Mm-hmm.
then. And
Definitely.
yes, dancing and
Mm-hmm.
personal conversations. Like I'm kind of person I talk to myself a lot. I intend to have conversations with myself. So just having like personal conversations and I think it
Great.
helps me to kind of be able to internalize a lot of things with myself.
Mm-hmm.
So I think that helps me. And eating a balanced meal. So I try to eat as healthy as I can. So
Mm-hmm.
I do stray once in a while, but I always try to pull myself back to make sure I eat very healthy to help myself, making sure I have calcium and enough vitamin D in my
Mm-hmm.
meal. And and just like general like self-care method, like I think me and you like we're both into essential oils. Even before I
Mm-hmm.
started, I put in my
Yeah.
essential oils right there just to kind of give it some
Nice.
nice fragrance and relaxing
Mm-hmm.
mood. And lighting the candle, having a shower, just little things to help you kind of take care of
Yes.
yourself. So these are some of the things that I do.
That's awesome. Definitely. I love of those things too. And I think it's so important. Yeah, like even just putting on some music and dancing around by yourself,
Yes.
like, just lifts your mood, and, or if it just can change it so much. And I love dancing too. And, doing that kind of stuff. I also like gardening. I have a garden, which in the summertime when the weather is nice, it's relaxing for me, which is something I really like. And I wanted to say about what did I, yeah, just taking time for yourself. Massages and acupuncture and chiropractor have helped a lot with my back pain,
Okay.
and joint pain and muscle pain. So I do that kind of thing. And writing in a journal helps me a lot,
Yes. Yes.
especially when I'm feeling overwhelmed. I
Yeah.
find that I get overwhelmed if I'm not writing in my journal. So if I'm consistent with it, it helps my mental health a lot. Like even if it's nothing, like whatever I'm writing, it's like, oh, why did I even write that? It doesn't, you know. But like even if it's just like, what did I do today, or like how was I feeling, what happened, and then putting like what you're grateful for that day, or what was the, you know, what was the best part of your day, what was the hard part, like going through and writing down. It's like just doing that every day or even every second day helps so much. If I don't do it for like a week, I'm ready for like a mental breakdown. It's like I'm
Wow.
like super overwhelmed by the time, like, and then I'm like, oh my gosh, I haven't been writing in my journal. I need to just go back to
It's a
that
way of
and
kind of
check in.
releasing that, yeah, it's a way of releasing that
Mm-hmm.
energy out. Yeah, I
Yeah,
definitely agree.
releasing
That's
it.
good.
Yeah,
Yeah.
so that and yeah, I just wanted to say too, like then there's so many different things as long as you have like time that you set aside for yourself and good hobbies that you enjoy that are relaxing and stuff. I was wanting to say like like with being so busy, like if you don't schedule self-care time, it doesn't happen. You know, like
No.
there's always something that comes up, and I find like if if I want to have self-care time and I'm not really strict about it, there'll always be something else that takes it away. And then you start resenting whatever that thing is that's taking away the time that you wanted to have for yourself. And then the more and more you don't set the time aside for yourself, then it starts just becoming more and more overwhelming. You continue to get more and more tired. And that's when I get to the point of like getting a breakdown. So I have to make sure, like, even if I schedule it, like, this hour is self-care time, or this, you know, like it, but it's so important because otherwise it doesn't happen. And I don't
Yeah.
want to resent things in my life. You know, I like my work, I love my family, my partner, my friends. Like I don't want to resent anyone or anything. So making sure that I put it aside, because it's so hard, especially if you're a busy person or if you're a mom and if you have family, if you have a lot of things going on. um and I saw Neve,
Someone said
hi.
hello. Yeah.
Hi, how are you? Hi, Neve. Thanks for joining. Yeah, so I just wanted to add that in. And yeah.
Yeah, I definitely agree. That was actually something there, like writing. Like even though I wasn't much of a person that used to write on journals when I was younger, I noticed I've gotten more into it. And what I normally do, even when I don't write, I have like audio. I just kind of record,
Hmm.
just talk and record what I'm going through,
Yeah,
and that really
just
helps
getting
as
it
well
out,
too. Yeah,
right?
getting it out helps definitely.
Yeah,
So yeah, I
that's
don't think we
awesome.
have. It is awesome. I don't think it's anything else on the list. I
Nice.
think just kind of exploring as well, finding things that makes you happy and that works for you. Explore different avenues. When it comes to self-care and taking care of your mental health, there's many ways. It's just finding something that works for you.
Hmm.
And I think that's really important just to explore because there's not one way to it. So yeah. I
Definitely.
think,
And I
yeah,
think, yeah, the general taking care of your health generally is just so important too. That goes for everybody, not just people who have POI, right? But like you're saying, eating well, exercising, making sure you're getting enough sleep. Those are
yeah,
basics that everybody has to do. And if you're slipping on any of those areas, eventually it catches up with you, right?
it does.
So it's, I know that it takes time and it's hard, but you have to do it. Like that is self-care too, right? Making sure that
It
you're getting
is.
that in, and then
Yeah.
taking the vitamin supplements or your medication on time, and you know, just making sure that, yeah.
Yeah, because that's also important. That's part of your health care. If you don't take it, yeah, I agree with that.
Mm-hmm, mm-hmm.
Definitely. Let's see if anybody has any questions for
Thanks for
us.
all the love, you guys.
Thank you guys for joining us. I don't think there's any questions.
I wanted to,
Um,
I know we're not gonna like get into it a lot today, but
yeah,
about like the infertility stuff and
of
not being
course.
able to have kids and that. Um, I didn't really share that at the beginning as part of my story, but yeah, like I've been told that I can't have children unless I had a donor egg. But I, you know, I still am not sure, because also sometimes you hear of like 5% chance that a woman has a spontaneous ovulation, and there's women who have POI who have gotten pregnant, and it's like,
Yes.
but it's never known as to why. So like that's why they changed it from premature ovarian failure to premature ovarian insufficiency. And it's like, so that is kind of hard to deal with too, because it's like, oh, like, is there hope or is there not hope? Like, it kind of messes with your head a little bit. Like, as in, like, am I going through all of this trauma and pain for like to have it all end well in the end? Or is it something that I should have accepted by now and I'm still hanging on to that little hope? Like, it kind of messes around with your mental health a little bit too, I think.
It does,
Yeah.
and it kind of it asks you, it kind of have you question, okay, if that person with POI can get pregnant, that means I can do it. Why can't I do it? How come that person
Hmm.
can do it? So it's really, I think it does mess with your mental health, and I think that's where it comes to. It depends on like individuals, because
Yeah.
although we're all going through the same condition, like, but everybody is kind of, everyone is different as well too,
Hmm.
and each person take a different path. And I think sometimes what I've seen in groups is like some people are on some certain treatments or something, like they have like a regime that they go through and it helps them get pregnant, and then someone else might try it and it might not work. So it
Hmm.
definitely has a major impact. It just makes you feel so overwhelmed and kind
Yeah,
of,
it
so
does.
it does.
And then deciding, sorry, go ahead.
I said it's really hard. Go ahead. Don't worry.
It
You can
is.
interrupt
It's
anytime.
because I think there's a little lag because of the network, and it's on my ends.
Yeah.
Yeah, and it's like making that decision of whether or not to do you want to try and have a kid and get a donor egg and go through that whole process of IVF, um, to have a miscarriage and have horrible heartbreak again, and to do another round of IVF and another round of IVF. Some people get pregnant on the first try, some people don't, and it costs a lot of money and it takes a lot of time, and you have to pump a lot of injections into you. It's so overwhelming to think about even approaching the subject of, do I want to do that? And then deciding, okay, or do I adopt, or do I decide not to have kids, like childless by choice? Like, I'm not going to try and do that, you know? But I have to say, like, what I'm really thankful with about that is, my partner has been really supportive of me, and he and I have been together for over 10, getting close to 10 years now. And I'm really, really thankful that he's very patient with me and very supportive with me about that, because it's such a difficult thing and it can break up relationships, you know, and you have, it's so much. And I'm really thankful to have a relationship with, my partner has a daughter who he had when he was really young, and we reconnected with her
Yeah.
recently. So she's like my adoptive daughter now,
So,
and that's really beautiful. And I feel the same love for her as a mother, whether or not, like, I've just gotten to know her over the last few years, but I feel that strong connection with her. So I'm
that's
really thankful
amazing.
to have that. And she calls me Mama Ava. And, like, I
Oh,
share things about her on my page and stuff. And we're working on trying to have her come and live with us in Canada right now, because she lives in Guinea in West Africa. So her mom is, and her family are on board with having her immigrate to Canada if we can get all the paperwork done. So that is kind of like in limbo right now, and we're just trying to make that happen. But
that's
I'm
amazing.
really thankful for that relationship, and I feel like that feels so right. Like, for me, like, maybe that's how I'm gonna be a mom,
Exactly.
like,
Maybe that's
even,
that's your path then. Maybe it just
yeah,
feels right for you that way. Like, okay, I'm contented with this. I'm happy with this.
yeah.
Yeah. But
and
yeah,
see
I
what
like
and
that.
see what the future holds, because
Exactly.
she's 18 already, like, but
Wow.
we have like a really cool relationship. And then I also have like a really beautiful relationship with my god kids. Danielle, I think you're still watching. Oh, I just see your comment. But yeah, Danielle has, anyway, I don't want to give a bunch of personal information over the internet, but I have a really
It's okay.
beautiful
We want to hear them
relationship with
all.
my with my god kids, and I'm really thankful for that. So,
Yeah.
so those are really beautiful things, and there are positives, that it's not
Oh
always
no,
dark.
Ava.
Like, yeah. And Danielle, I said,
She'll be back.
it can be it can be very overwhelming. Oh, sorry about that. I was just reading Danielle's comment. It said, it sounds overwhelming and tough. You ladies are so strong. And thank
Oh,
you.
thank
It
you.
can be very
Yes.
overwhelming, that's for sure.
Yeah.
Yeah. But yeah, like I was just saying, I don't know if it cut out at that point, but that there can be a lot of positives to having relationships in those ways with kids, whether or not they're your biological kids or not.
Oh, no.
And
Yeah.
then just seeing what the future holds, like, you never know. And I'm trying not to be so hard on myself to be like, I have to make a decision right now. and just let everything kind of unfold in its time, you know, and see what happens, and then make the right decision for me when I get to that point.
And that's a great approach, because it shows that, you realize what you're going through, and you're just willing to kind of see how life goes, and you have this amazing support, and your daughter.
Yeah.
So she's your daughter. She's your daughter.
Yeah,
So
she is.
to have a great relationship with her it's really, really good. And for me personally, for when we talk about infertility, I think we've spoken about this before. I think with my very first relationship that I had, and one of the reasons we broke up was because we wanted to go our separate ways, because he wanted kids. And I was still very young. Then I was like 22, 23. I was like, no, I'm not ready to have kids. And I know I can't have kids. So I did tell him about my POI, and he was very supportive about it. It was one of the guys that was like, okay, if it comes to a case whereby we have to go get a second opinion, maybe abroad or in America or somewhere else. So it was very supportive. But I knew that he wanted kids. He was much older than me, was in his 30s. I was like, no, he wanted kids, and I wasn't ready. And
Right.
I knew that I possibly could not have kids. And I was still, getting to know myself as an individual. So I was like, no, I don't think, I think we should just go our separate ways. And, so that's how we ended the relationship, which was understandable. So it was fine.
Yeah.
I think
I'm
for me
sorry to
over
hear
the
that. It's
years,
still tough, you know. It's
I
hard.
think for me over the years, I've actually had to have like a tough conversation with myself. Like, okay, what do I really want in terms of bringing a child? Do I want to have a child? Do I want to be childless? Do I want to adopt? Or what do I really want to do? Do I want to go to IVF and stuff? And I think I really have to think about it. I'm going to be emotional about when it
It's
comes to that.
okay.
I think I really had to have a deep conversation with myself in regards to that. And for me, adoption is the way to. I've decided adoption is what I'm going to use to bring the
It's
child into
beautiful.
this world. Yeah. So I'm going to go through adoption. And I know because even though I think I said this before, even though if I'm to, let's say, try and carry my own child by going through IVF or not egg donor or whatnot, it's like I don't want to bring a child into the world as well that could potentially go through infertility as well too. You know what I mean? Because I'm sure there is genetic, it can happen. So I don't want to bring, for me personally, that's just me. It's completely different
Yeah.
for everybody else. I don't want to bring a child into this world that could potentially go through infertility as well too, because I know how hard it is, and I know how, even though you have people around you supporting group, sometimes you can still feel like you're alone, and you have to kind of remember yourself that you're not alone. You have groups and support and everything. So I decided adoption is the route for me. So
That's amazing.
in the future, so I'm just kind of saying, okay, let's see how let's just see how things go. Just try and live your life, and
Hmm.
see how things
Yeah.
can go. So that's it for me in terms of
Yeah.
infertility. Ah,
That's beautiful. And you know, I think is that's so beautiful, and it
yeah,
is important to not be too hard
yes,
on yourself of having to make the decision right now. And
yeah,
especially if there's any ladies watching who have just been diagnosed with POI, like Anita and I both have had it for over 10 years now, right? And it
yeah.
takes many years, and you're going to go back and forth and back and forth with
Hmm.
what you, so don't be hard on yourself if you don't know yet, you know, what
Yeah,
you want. And just make sure you take that time, like Anita said, what she did, and really like take a hard look and really like decide and talk with yourself about what it is you want. And yeah, especially like I don't think in the first few years of being diagnosed, it's like so overwhelming to think about
it is.
everything,
It's
you
not even
know?
something you think about, because you don't have the time to even start thinking about, am I gonna, because you're going through so much, like you're going through so
Mm-hmm.
much that you're trying to understand. So you have to get to a point. I think it's when you start to get older, you have to say, okay, what do I really want? What do I really want? Do I want to have a child? What do I want? What path do I want to go to? So I think that's
Mm-hmm.
when you get to that point. It takes progress. So don't feel rushed. Don't feel like you have to make a decision right now for yourself.
Yeah.
But I
Mm-hmm.
know that at the same time, like Ava, you said,
I
if
still
there
don't
is a,
know.
yeah, but you made a point the other day, like, if you've just been recently diagnosed and there's a possibility you can reserve some eggs, do so. That was something, if you can do that,
Yes.
because you never know what the future holds. But if that's not what
Yeah.
you want to do either, whatever path works for you, I think it's fine. It's your decision.
Yeah,
And I think sometimes society can make us feel like if you can't have a child or carry your own child, then you're less of a woman. But not don't
right.
allow anybody to make you feel that way. Definitely.
Exactly. And also, like, yeah, for me, when I was diagnosed, I was so young and there was so much to take in. I remember it being mentioned about looking into saving eggs, but I was like 17 and then 18 years old, and it was like too overwhelming. And I was just graduating school and I was going to get ready to go for college. And I was just like, it's I don't have the money. I don't know what to do. Like
Yeah.
maybe if this is what's meant to be, I shouldn't mess around with trying to save eggs. I don't know what's going on. That's kind of where I was at that point. But now, 10 years later, I really regret not saving eggs, or at least looking into the possibility if I could have had eggs to save at that point, when it was near the beginning of being diagnosed, when I was still kind of getting some periods and then kind of not. It's like, I don't know if there would have been any eggs to save or not, but it
Yeah.
does hurt me. And I do cry about that a lot and feel a lot of regret over the fact that I didn't look into that more, because now I wish I had that option. And sometimes when you're young, you don't know what you want to do. And at that point, I also wasn't with my partner. I didn't know that I would meet someone who I wanted to have kids with someday, you know? And so it, oh, it's really,
Uh,
really, I have a lot of regret about it. So I think if you have the option of doing it, even if you freeze some eggs, it doesn't mean you have to use them. It just is an option for you there if you want to use them at some point in the future. If you don't end up using them, it's okay. But
yeah.
having that option when you get older is so nice.
Yeah.
But yeah,
It's
it's
that was
tough.
not even something that wasn't even something that was said to me. Like I had no idea that you could even do that. It's like it's when I got
Mm-hmm.
older I started learning that you could do that. But I was like,
Mm-hmm.
I'm 31 now. What am I? It's like that's not.
I
I'm in a
know.
different wave right now. I'm completely in
Mm-hmm.
a different wave in life. So I'm taking like a different path. But if that was an option, maybe that was offered to me when I was initially diagnosed, like, okay, you can have
Mm-hmm.
potentially have kids. Maybe you have
Mm-hmm.
a bit of. Basically, I was told I had no eggs. So to
Mm-hmm.
me, it wasn't something I was thinking,
Yeah.
okay, I'm going to have kids in the future because I have no eggs. But
Have
the
no
fact that
anxiety.
some people can still preserve some eggs if they have a little bit, that should be an
Right.
option given to them.
Yeah. Yeah,
So
and I don't know how it is now, but back then too, I also think like I didn't even have I didn't even have Facebook. Like the internet was so new. I didn't have
yeah,
like a lot of stuff to research, and also it felt kind of like some weird science experiment. Like I didn't know, like you know. So I don't think that was like a little bit part of it too. But now we've seen that it does work for a lot of women, and if it is an option, but. Yeah. Anyway, I saw some comments. Let's take a look and see.
okay, let's have a look.
Oh, Lori said, "Oh, so cute and sweet." And she said, "Adoption is wonderful. My mom had 3 miscarriages and I was
Oh,
adopted." Thanks for sharing that, Lori.
thank you. Let's see. I wish I knew earlier. Exactly. That's what it's like. I wish that was something
Hmm.
that was said like earlier,
Yeah,
but
Lucy said she
no,
found out she had POI when I was 30, and she said, "I'm 34 now. I wish I knew earlier." Yeah,
it's
it's
hard.
tough. It
It
is.
is tough. It's not easy. And
Sorry.
I think the other thing as well that's the other thing as well for me is that is other misconception that people have that when you tell them like you're going through pretty much menopause, and they're like,
Hmm.
"What? You're too young? What now? What do you mean? You're too
Yeah,
young for that?" Because it's
I still
associated
get
with
that.
someone.
Yeah.
Yeah, I get that all the time. I still get that.
Yeah.
Because I think it's associated with someone who's like 50, 51. I'm like, no.
Hmm.
People from the age of 12 get menopause. Like, what? No. I remember
Hmm.
telling the lady once when I told her that I have, she was like, wow. She told me, she's like, she started laughing. She's like, I would not have thought people, someone as young as you could get. I was like, well, people as younger may still get it. So
Yeah.
as well, there's still a lot of that misunderstanding there. A lot of people think
Yes.
it's associated with older people. And when people make comments as well, I know it can be really difficult when you tell someone because they think you're
Hmm.
making it up or you're trying to,
Yeah.
it's hard and
And when you're
just
constantly having people dismiss your condition, it is hard
yeah,
because you start to feel like,
it is.
then you don't even want to tell people after a
You
certain
don't want
point.
to. No, you
you
don't want
know?
to tell them. I think that's why you have to be very selective in who you tell and who you have discussions with in terms of, especially if you're close with, you're telling friends or family,
Hmm.
they're not always going to be supportive because not all of them are going to understand. So you have to be very careful who you go to and talk to. You want someone
Hmm.
who is supportive, who is understanding. They might not understand you, but they can
Who
actually
has
understand you.
empathy and
Exactly, empathy.
yeah,
So you want people like that around you. So
yeah,
it's very, very, very important. That's also part of mental health as well, to have people around you
yes.
who are um, supportive. How
Hmm.
easy was it for you to diagnose? Oh, everybody, you want to go first? I think you spoke about that a little bit earlier
Yeah,
on.
so for me, the hard part about it was because I was so young. My doctor kept putting it off as like, oh, young ladies in their teens when they're first starting their periods have irregular periods. Sometimes it's normal. Don't worry about it. So that part was hard because we kept being told like, oh, it's fine, it's fine. And we kept going back to the doctor. And then it was like, I didn't have my period for a year. And we went to the doctor. I was like, I haven't had my period for a year. Like I went through puberty, I had it and it's
Yeah.
gone. And it's been a year. Like something is wrong. So that was the hard part, was pushing to get to the right tests and pushing to get to see the right doctors, having to advocate for it. And then because being told for so long, oh, there's probably nothing wrong with you, it's normal, every woman goes through irregular periods at certain times, then when you get diagnosed, it was like the shock, right? So the diagnosis actually was off of a blood test for me, one blood test, and then they did another blood test a little later to repeat it to make sure that it was the same. And so for me, actually, the diagnosis, when the right doctor saw the right blood test, the diagnosis came right away. But it was getting to the doctor who knew about it that was the hard part.
For me, like I said, I didn't have period for nearly 4 years. So when I had the first one, I wasn't really, once I was told it's okay, so I wasn't really like, I was young. So I thought, okay, an adult knows better. So I just kind of went about going my secondary school and whatnot and everything else. So it's for nearly 3.5 years, I didn't have a period. So until finally I was advised to go seek medical advice. So that's when I went. I initially went to my GP, and my GP did a blood test and they referred me to a gyno. When I got there initially, they did a lot of blood tests. I didn't really understand what was going on. Like it wasn't explained.
Mm-hmm.
I was just there because I knew something wasn't right, but I didn't
Mm-hmm.
understand what was going on.
Mm-hmm.
So the gyno did some blood tests, and I think they did an ultrasound as well. And at a point, I had a surgery. I think that was to check my ovaries or something like that. I can't remember, but I know there was a surgery, there was an ultrasound, and there was a few other things that was done. And then after that, with blood tests, I got called in, and I think it took about a few months. I got called in, and I was told I have premature ovarian failure.
Yeah.
So it took a few months, and I think the only thing for me, I wish that they would have kind of educated me along the way, even if I didn't really understand the process,
Mm-hmm.
but at least just kind of let me know this is what we're doing. We're doing this because of that. We're doing this because of that. We're
Mm-hmm.
doing this because of that. It would have really like helped me along the way to understand what was going on. But yeah,
Yeah.
so
And they're also kind of in a lot of shock when you're trying to
yeah,
take in the information. You can't understand what's happening.
yeah,
It's really overwhelming.
it is overwhelming.
Um, and then because for so long I've been hearing people's messages of you're too young to have menopause. It's fine. Nothing's wrong with you. Don't worry. Then getting the diagnosis, like I was just in denial for so long because I'm like, well, it can't be true. How can they know that off of a blood test? Like, what? Like it was so, yeah, it was hard.
That's one of the other reason. Like if you're doing blood tests, you say, okay, I'm doing blood tests because of this, because we're trying to look for this. I feel like
Hmm.
if you relate that to the patient, in a way they kind of understand, okay, they're doing this because of this. Okay, what are you looking for? You know what I mean? So of just kind of
Hmm.
being left there
Yeah.
and then come back and be like, you have this condition. You're like, what?
Yeah, yeah. That
How?
was
How
something
come?
that, yeah,
Yeah.
the appointment where I was told by the doctor the diagnosis was a really awful day because it was so shocking and it was told to me very bluntly. My mom and I remember we were there together. And so I was just like, it was so blunt. And the appointments are so short. And it's like you get told this and then you get thrown out into the street and we're walking to our car and we're both just crying, being like, what? This can't be true, you know? So, yeah.
Yeah. It's crazy. I'm so glad,
Mhm.
Ava, you're here to share your story
Thank
today.
you.
If
Thanks so
anybody
much
else,
for having me on.
it's not a problem. I'm very happy to be here. If anybody else has a question for us, Ava, is there anything else you'd like to add at all? I can't think of anything else myself.
Um,
I think we pretty much covered everything,
we
haven't
covered a
we?
lot. We did. I wonder what time is it? We covered a lot.
Yeah.
Thanks for everybody who followed along for the whole time. And yeah, if we think of anything, I'm sure that there'll be something, let's see. I think I shared everything I wanted to share
Yeah.
today. How
Good.
about you?
I did as well. I think we covered a lot. We
Yeah.
even talked about it because we didn't think of talking about the infertility part of
I
things.
know.
Yeah.
Sorry, it
So
just
it's
kind of
good. No,
came up.
no, no. No,
Yeah.
I'm glad that we covered that as well too. So I'm very glad. So
It's a
we
tough
covered a lot.
subject though.
Yeah.
Yeah.
So yeah, I'm glad that it's important to actually talk about that. So yeah, we covered a lot, guys. If you have any questions for myself or Ava, you can just send us a message, and
Yeah.
you're welcome. Send us a message, and yeah.
Thank you.
Ava, thank you so much for being here
Thanks
and
so
sharing your
much.
story.
Thanks for having me.
And no problem. And I
Yeah.
will
Oh, and
catch you later.
actually, there was one more thing.
Oh
Um,
yes, yes,
uh,
yes. I forgot.
what, you go ahead. You go ahead.
Okay. So I forgot actually. Thanks for reminding me. So Ava and
Just
I are
remember,
currently
brain
working
fog.
on. Yeah, I know. Blame it on the brain frog. Yeah. Um, Ava and I are currently working on something for the POI community. So it was an idea, and we both um, thought like it would be a great idea and to be of a benefit to people who are going through POI, especially if you've been newly diagnosed or diagnosed a long time ago. I feel like it would be of a great benefit to the community. So we're currently working on that. We just want to let you guys know. So we'll give you guys more information on that as the time progress. So yeah.
Yeah.
Anything else you want to add?
Looking forward to it.
Yes.
Yeah, no, thanks again, and it's going to be great. And thanks for everybody who watched and for all of my supportive friends and family. Like, I really appreciate if you've gotten to this point and you're still watching. I love you guys. You're
Thank you
amazing,
so much
and
for watching,
thank you for
guys.
tuning in.
We should do this
Yeah,
again sometime.
sounds great.
All right.
Thanks.
Talk to you
Have a
later.
good night.
Bye. Bye.
Bye.
Bye. Bye.